Hi, good morning. My name is Z. I'm a Chinese herbal medicine practitioner, and I'm practicing herbal medicine for more than 13 years. And I'm going to introduce one of the case I have yesterday about a 70-year-old man. And this old man come in complaining severe shoulder pain, joint pain. And the pain was so much that he just couldn't sleep at night. So the pain was so much that it's been unbearable, and he have a difficult time sleeping. Whenever it's cold weather, he will suffer more. For example, when it's winter, when it's fall, and the pain will aggravate. So it has come to a point that he come seeking treatment over and over. So we do an eye exam as usual, and what we find is that we have a weakened kidney. As you can see, the kidney, the pupil, the corresponding to the kidney. And obviously here, the pupil looks very small, and the texture is very loose. And the color of the pupil appear yellowish, greenish, which is abnormal. So this is an indication of a weakened kidney. And if we look further, we're gonna find his stomach has inflammation, has a lot of inflammation here. Look at this squiggly line here. Those are the indication of the stomach inflammation, stomach condition. So as a result, you can see that the yellow stain, the yellow stain surrounding this the white of the eye. So that indicates the excessive excessive body fluid due to the indigestion. Some people can call that yeast infection, or some people would call it mold infection. It's the same thing. It's due to the indigestion. It can be traced back to the stomach inflammation, stomach condition. So we keep looking, we keep do the exam, and we find. Look at this. This red spot here, the vein here, it clearly indicates that his cardiovascular condition is very bad. Look at this red spot here. So that indicates some blockage in the cardiovascular area. So people with this kind of symptom usually would have sleep apnea. One of the most commonly seen symptom on this kind of people is sleep apnea. So the first question I ask him is that, do you snore heavy? And it turns out, yes, he does snore very heavy. So heavy snoring is just the first step before you get the sleep apnea. So in this case, this old man has it turns out he also have the sleep apnea, and is seeking treatment on that, but he refused and insists on the herbal treatment on his own until he comes see me today. And keep looking the other eye. Again, the pupil looks very bad, very small. The texture is not right, very loose, which indicates the weakened kidney. So the weakened kidney will affect the water metabolism, right? Look at here. That indicates the stomach inflammation, indigestion. And look at here, the stomach again. We can clearly see the yellow stain here. The yellow thin of the white of the eyes. That's a sign of indigestion. And so the other eye also showing the severe heart condition right here, squiggly line going all the way, connecting to the stomach. So what we can see from that, what we can make of that, it actually is a syndrome that a weakened heart affects the stomach digestion, and as a result, the body retaining a lot of fluid, and this excessive fluid, which is toxin, from another perspective, it's a toxin. So this excessive fluid can go everywhere, circulating. So in combination, what can we make of that? Here's what we can make of it. It's a syndrome that a weakened heart affects the stomach, and as a result, the stomach developing indigestion, things like ulcer or weakened stomach, and in turn it produces a lot of excessive body fluid, and this body fluid, from another perspective, is a toxin. It can circulate around the body everywhere. For example, it can circulate to your knee, develop into your knee pain, joint pain. It can circulate up to your shoulder, develop into shoulder pain. And that is also why that the pain get worse when it exposed to cold air, such as like season like winter and fall, because just think about it, when you exposed to wearing a soaked wet suit exposed to cold air, and you can imagine how much cold and pain and the kind of discomfort sensation you will feel from exposing to the cold air. And that's how this old man's joint pain come into being. And also, when I ask the question, for example, if you look at a stomach condition like this, I asked the old man, do you have stomach acid? Yes, he does have it. And why would he have stomach acid? That's because when he have a weakened stomach, then he would have trouble digesting the water. That's how he get the stomach acid. Another symptom will be some people would have difficult time digesting water. Then as a result, they won't feel like drinking water because they're already holding too much water, so they don't feel like it. No matter how much thirst that they feels, how much thirst they feel, they still don't feel like drinking water. They take a sip and then that's it. They don't actually drink it. And another condition will be people feel a lot of thirst. They keep drinking water, but the water doesn't get digested in the system, and they go right out. And shortly after,
that means you drink and then you go to bathroom right away?
That's right. Yeah, you drink the water, it doesn't have a chance to get digested, and then you go directly to your bladder, and then you have to pee. We see a lot of people like that. They constantly feel thirsty. They drink a lot of water, but they also keep peeing over and over, just like the water doesn't stay in the body. Okay. Right? In a normal healthy condition, people drinking water and they get a chance to get digested, and the water can translate it into something that can nourish your body. So it's a process. It takes time. So you take like a long while before you actually urinate, go peeing. So this is what this old man has. He constantly feel thirst. He drink a lot of water, but then he'll pee a lot.
No wonder the painkiller will not help him.
Yeah. So look at here. The other eye. We look at the shoulder area, neck and shoulder area. He also had a lot of inflammation in the neck and shoulder area, particularly the neck cervical area. for example, he would have symptoms like a stiffness, tightness in the cervical neck area, but the man is so preoccupied by the shoulder pain, he doesn't really feel it. The other picture also showing the neck and shoulder area, the pain and stiffness.
Okay, so the treatment for now it will be.
The treatment is simple, and you just need to strengthen the heart and also to strengthen the stomach. On the other hand, we need to do something to flush out the excessive body water, which is toxin. When you have too much water in the body, it turns into toxin, and this toxin can produce a lot of unwanted symptoms and signs, and keep bothering you.
Good, a very interesting case. So as shoulder pain, it turned out it's the heart condition.
Yes.
The root problem is the heart condition and the stomach problem.
The root problem would be the heart and kidney kidney condition,
well.
because whenever these two systems in trouble, they will have a hard time to circulate the body fluid, and as the secondary complication will be the stomach. Stomach will have a hard time digesting anything, including water. So that's how people, when you're getting older, you find your appetite reduce.
Okay, very interesting.
Okay.